Hello and welcome to the MedPorium podcast, where we discuss everything medical from various case studies, research articles, and interviews with healthcare professionals. My name is Jahangir Kareem, and I'm the managing partner of MedPorium. In today's podcast episode, I want to discuss the effects of caffeine. Now, caffeine is the world's most used stimulant, and it is used around the world through a common beverage known as coffee. Through this podcast episode, you will learn what caffeine is and where it can be found, the origin of caffeine, how caffeine affects our nervous system and metabolism, the harmful effects of caffeine and some side effects, the risk of chronic diseases, and how caffeine can actually benefit or make you more vulnerable to those chronic diseases, how caffeine affects pregnancy, and the age-old question of will coffee stunt a child's growth. I also want to discuss throughout the end of how to optimize the effects of caffeine. To start, we need to discuss what caffeine is. We want to define it as a stimulant, which is a substance that increases the activity of the nervous system. And caffeine is the world's most popular drug. It is the world's most popular stimulant. Now, the stimulant is found in plants, and most common beverages that contain caffeine include coffee, tea, as well as some soft drinks and energy drinks. Caffeine is also found in chocolate. Now, caffeine in its purest form is a bitter powder and is classified as a methylxanthine alkaloid. Now let's move on to the origin of caffeine. Now, back then, coffee was the main beverage that contained caffeine, and it is thought to have originated from Ethiopia, which is located in the Horn of Africa. Now, coffee back then was a new beverage, and it was introduced into Arabia and the rest of the Middle East in the 4th century. Now, back then, coffee was so popular that many people set up coffee shops in many popular Middle Eastern cities such as Istanbul, Cairo, and Mecca in the 16th century. Now, through this popularity, coffee spread to Europe, with many coffee houses established where many scientists, businessmen, and politicians would gather and share their thoughts and ideas. Now, coffee has been hypothesized to have fueled the Industrial Revolution and allow for new ideas, more strides in math and science just through this beverage. Now, back then, there was a German scientist named Friedrich Ferdinand Runge, hopefully I'm saying that correctly, who was the first to extract caffeine from cocoa beans. Now, coffee is still one of the most popular beverages, and according to the National Coffee Association from 2020, almost 62% Americans drink coffee every day, and the average American coffee drinker drinks over 3 cups of coffee per day. Now, 3 cups of coffee per day is pretty high, and the question I want to address is, does drinking this amount of coffee affect the body, and how does it? Now, to discuss the effect on the body, I want to discuss the nervous system, how caffeine affects the nervous system. And to do this, we need to discuss adenosine. Now, adenosine is a molecule that is part of an energy molecule called adenosine triphosphate, or ATP. And ATP is a molecule that is used for energy. Now, when the body breaks down ATP, adenosine is released, and adenosine binds to adenosine receptors on the neurons, which promotes relaxation of the neurons and dilates the arteries. Now, adenosine is an inhibitory neurotransmitter, and what I mean by this is when adenosine binds to the adenosine receptors on the neurons, it basically slows down the firing of the neuron. Now, the slowing down of our neurons can prevent action potentials from spreading throughout the body, which can result in making us feel sleepy or drowsy. These adenosine receptors, or adenosine in general, allows us to control our circadian rhythm, and these high amounts of adenosine allow us to feel sleepy. Now, here's the thing. Caffeine has the same structure as adenosine, and this means it can bind to those adenosine receptors. Now, caffeine acts as an antagonist and prevents adenosine from binding to those adenosine receptors. So why is this such a problem? Well, adenosine, when bound to the adenosine receptors, it promotes relaxation and sleepiness and drowsiness, like we said before. But if caffeine binds to that, it allows the neuron to continue firing, since adenosine is not able to bind to that receptor. Now, usually caffeine binds to the adenosine receptors before adenosine can actually bind to those receptors. So what results is these neurons that continue to fire since they don't have adenosine preventing them from doing so. Now, to put this in simple context, let's represent the neuron as a teenager and the adenosine as a mom. Now, the setting for this is nighttime, and the teenager wants to go out to party, but the mom, who's the adenosine, prevents him from doing so and wants him to stay at home. This is basically what adenosine does. It prevents that neuron from firing or doing any sort of movement. Now, caffeine will represent our friend who's sort of a bad influence. And when that friend comes over, he tells that teenager to go to that party now. So the teenager most likely will move out of the house or sneak out of the house to go to that party. And this is what caffeine does. It allows that neuron to keep firing, to keep producing the action potentials. So think of adenosine as a mom who tries to control the teenager or neuron, and caffeine who just wants the neuron to feel free and keep firing. Now, as we discussed, caffeine acts as an antagonist, and since it prevents the adenosine from binding, it promotes wakefulness and alertness because caffeine allows the neuron to continue firing. Now, caffeine is also said to activate noradrenaline receptors, which is responsible for that fight or flight response. Now, dopamine is also released when caffeine binds to those adenosine receptors, and dopamine is a neurotransmitter that is responsible for a feeling of happiness. Now, there are other neurotransmitters that are released, such as serotonin and acetylcholine. And serotonin is responsible for this vasoconstriction of the brain of the arteries, and the acetylcholine is responsible for the vasodilation of the peripheral organs. Now, there was a study published by Scientific Reports that investigated how moderate caffeine doses affect the nervous system cell expression. Now, they found that caffeine regulates the CREB-dependent gene expression, which can enhance short-term and long-term memory, as well as it promotes the expression of immediate early genes, or IEG, which plays a role in brain development, cognition, and neuroplasticity. Now, you may be confused at this point since I did bombard you with a lot of medical jargon, but to bring this in simple context, they found that caffeine increases cognition, memory, brain development, and neuroplasticity. Now, neuroplasticity is a very complex topic that I'll discuss in a future podcast episode. But to bring this in simple terms, neuroplasticity is the ability of our neurons or our brain to basically change structures depending on what we're sort of doing. An example of neuroplasticity would be me trying or learning to juggle 3 balls at a time. Now, each time I practice and I hopefully get better, my neurons or my brain creates more synapses and breaks down some neurons to create a shortcut so I can actually perform that action easily and better. This is where the phrase practice makes perfect comes in. It's when neuroplasticity, or the ability for us to change the structure of our brain to create more synapses, allows for these shortcuts so that we can perform whatever action or whatever movement we're trying to do, we perform it better. Now, this caffeine gene expression that I discussed before has been linked to increased connectivity of neurons by controlling axon growth, which is just a part of the neuron. Now, the scientific reports also found that caffeine may have an inhibitory effect on wound healing if taken at high amounts, which is a disadvantage, but it says it's taken at high amounts. And these high amounts would include caffeine levels over 600 milligrams, which is a lot. Now, these findings of the gene expression helping with memory and cognition can explain why the consumption of caffeine can decrease your risk of Alzheimer's disease, which I'll address later. Now let's move on to the effects of metabolism that caffeine has. And to do this, we need to discuss caffeine absorption and the metabolism of caffeine. Now, caffeine absorption is complete within 45 minutes after ingestion, and the peak plasma caffeine concentration is reached in 30 minutes. Now, the effects of caffeine can last from 8 to 12 hours. Some people, they even last to 6 hours, depending on the person's race, gender, ethnicity, and even age. Now, caffeine in tea and coffee is absorbed at similar rates, and caffeine absorption from soft drinks and chocolate tends to be slower compared to caffeine capsules, coffee, and tea. Now, when we ingest caffeine, the caffeine is distributed in all body fluids, such as the blood, the cerebrospinal fluid, saliva, and even semen, just to name a few. Now, caffeine is one of the molecules that can pass the blood-brain barrier. And if you don't know, the blood-brain barrier is a tightly managed membrane which only a few particles, including water, can go through. Now, caffeine is metabolized in the liver with a protein called the CYP1A2, in which caffeine is broken down into 3 metabolites. The first includes paraxanthine, which stimulates the central nervous system and exerts an anti-inflammatory effect. The second one is theophylline, which is a drug that allows for better breathing, and the third one is known as theobromine, which may act as an anti-tumoral, anti-inflammatory, or cardiovascular protector molecule without any of the side effects of caffeine. So overall, this theobromine, which is part of the metabolites, is the most useful, brings the most benefit from caffeine. Now, hopefully, I pronounced the names for the 3 metabolites correctly. And I have a link from an article from the National Institutes of Health that discusses the health benefits of theobromine. Now, there's another protein known as the CYP2E1 protein, which is responsible for the formation of theophylline and theobromine, as well as N-acetyltransferase 2, or NAT2, which is also responsible for caffeine metabolism. Now, hopefully I pronounced both of those correctly. Now, one thing to note, as I discussed earlier, is that caffeine metabolism varies due to genetics and other factors such as height, age, sex, weight, and etc. And as I discussed before, ethnic backgrounds play a role in caffeine metabolism. Now, since we are in the topic of metabolism, I want to move on to weight loss and how caffeine affects weight loss. Now, according to the American Journal of Clinical Nutrition, caffeine consumption induces weight loss by increasing thermogenesis, which is the production of heat through the ingestion of glucose and triglycerides. Now, this consumption of caffeine results in an increased energy expenditure of 100 calories per day from 600 milligrams of caffeine. Now, caffeine also increases lipolysis and fat oxidation. Now, lipolysis or lipolysis is the breakdown of fat. Now, both of these processes destroy or get rid of fat, primarily the white adipose tissue. Now, if you've seen our first podcast episode about the obesity epidemic, you will understand that white adipose tissue is a bad fat. Now, caffeine can also be used for sports performance and exercise, and it has been said to increase skeletal muscle function for activities lasting greater than 30 minutes. Now, this increase in skeletal muscle function results in increased endurance, speed, and power for whatever exercise or sport that you're competing in. Now, on the other hand, an acute decreased insulin sensitivity is seen with the ingestion of caffeine, but this is only if caffeine is ingested at very high amounts. Now, the reason why decreased insulin sensitivity is a bad thing is because it can increase your risk for type 2 diabetes. Now, as we're on the topic of some small effects of caffeine, I want to discuss the side effects of caffeine, some of which can actually be detrimental. Now, I'm going to list off some side effects that caffeine may inflict, but I want you to understand that these side effects only occur if you drink over 400 milligrams of caffeine. Now, the very harmful effects that can be detrimental only occur with an intake of 1.2 grams or more of caffeine, and it can be fatal if one has 10 or 14 grams of caffeine. Now, some of the most common side effects include caffeine tolerance, anxiety, restlessness, insomnia, fast heart rate, and polyuria, which is an increased urine output. Now, many of these side effects that I just listed off are due to the caffeine activating this fight or flight response from those noradrenaline receptors that we discussed earlier. Now, the side effects can be more severe from the withdrawal of caffeine. To put this in context, let's look at this through the eyes of Bob. Now, Bob drinks 2 cups of coffee per day. Since he has a strenuous work schedule, he increases his dose to 3 cups of coffee per day. Since 2 cups of coffee aren't enough, the 200 milligrams of caffeine haven't been really helping him to feel that alertness or wakefulness. So this works for the next 2 months until Bob realizes that the 3 cups of coffee per day isn't allowing him to feel enough wakefulness or alertness. So Bob increases his dose to 4 cups of coffee per day. Now this is a perfect example of caffeine tolerance, in which the body requires more caffeine to feel the same effect as before. The same process occurs in opiate abuse, which is seen when tolerance is built up. Now the reason why Bob is feeling caffeine tolerance is because his body is trying to maintain homeostasis. And homeostasis is a process where the body tries to bring itself to a normal position, a stable environment. Now as Bob increased his coffee dosage from 3 cups per day to 4 cups per day, he increases the amount of caffeine he ingests, and that caffeine will bind to mostly all of the adenosine receptors, and the body will react by producing more adenosine receptors so that the adenosine can bind to those adenosine receptors and the Bob can actually sleep. Now let's just say Bob stops drinking coffee for some apparent reason. Now, since Bob is not drinking coffee anymore, he has withdrew himself from caffeine, and this results in some withdrawal symptoms such as headache, sleepiness, and drowsiness, as well as some other symptoms. Now, the reason why Bob is witnessing headaches is because caffeine has been linked to increase in our fight or flight response, and through our fight or flight response, we usually see vasoconstriction of the brain's arteries. Now, since caffeine is not ingested, this can result in the opposite, the vasodilation, in which the arteries become bigger. And through headaches, usually the brain's arteries, it'll result in vasodilation. And those arteries will basically push against the brain. Now, the brain doesn't have any pain receptors, but the meninges do. And the meninges are 3 layers that make up sort of the outside of the brain. The meninges have pain receptors, and this results in a headache when the arteries push against the meninges. Since Bob has been used to this vasoconstriction, in which the arteries were smaller, but since they are bigger, they push against those meninges, which result in that painful headache. Now, adenosine also has this vasodilation effect. It promotes this vasodilation effect, which further severes or makes his headache more severe. Now, the reason why sleepiness and drowsiness is seen with Bob is due to the adenosine binding to those excess adenosine receptors that have been created through caffeine tolerance. Now I want to divert our attention to sleep and how caffeine consumption can alter sleep. And to do this, we need to discuss the 2 main sleep types, which include REM or rapid eye movement sleep and non-REM sleep. Now, non-REM is broken down into 3 stages. The first stage is this transition between wakefulness to sleep, which is usually lasting a couple minutes. An example of this is just lying down on your head for about 5 minutes. Now, stage 2 includes non-REM sleep, and this is a period of light sleep in which body temperature drops, heart rate begins to slow down, and the muscles relax. An example of entering stage 2 is taking a 20 or 30 minute nap. Now, stage 3 non-REM sleep is also referred to as deep sleep, and this is required to function from a physiological standpoint. Now, this REM sleep or rapid eye movement sleep occurs about 90 minutes after falling asleep, and this is when your eyes move rapidly between your eyelids in a side-to-side motion. Now, in this sleep, breathing becomes faster and your heart rate and blood pressure increase almost to normal levels. Dreaming also occurs in this type of sleep, but some dreaming can also occur in stage 2 and stage 3 of non-REM sleep. Now, if you've ever dreamed before, you know the feeling of trying to wake up from that dream, and it's very difficult. It's also difficult to move from your bed, since in REM sleep, you're temporarily paralyzed. Now, according to a study done by the Journal of Clinical Medicine, caffeine taken 6 hours before bedtime has important disruptive effects on sleep and can reduce sleep by more than 1 hour. Now, you might not believe sleep or losing sleep by 1 hour is that detrimental. And for adults, it isn't that bad as long as it's not continued for a certain amount of time. But for children and teens, it can actually be very detrimental. This is because when we are children or teenagers, we're still growing, we're still going through puberty, and our body requires more sleep. children require 8 to 10 hours of sleep, as well as teenagers. And if a teenager or child sleeps for only 7 or 6 hours, this can be detrimental to their potential growth. Now, I've noticed before that there are some people that are able to sleep perfectly fine, even after ingesting caffeine after 2 p.m. or close to 6 hours before bedtime. This always confuses me. Well, the reason for this is their ability to metabolize caffeine more easily, or the fact that these people have developed a tolerance to caffeine, which requires them to consume more caffeine to feel the alertness and wakefulness feeling. It has also been shown that nicotine can reduce caffeine metabolism by 50%. Now, the consumption of caffeine over 400 milligrams can result in increased blood pressure, palpitations, overactive bladder, dehydration, and decreased insulin sensitivity at abnormal amounts, which would be about 6 cups of coffee per day, or about 600 milligrams of caffeine per day. Now let's discuss the effects caffeine has on chronic diseases, and the main beverage that contains caffeine is coffee. Now, coffee has been shown to decrease the risk of melanoma, squamous cell carcinoma, basal cell carcinoma, breast cancer, endometrial cancer, and hepatocellular carcinoma. Now, coffee has been also linked to a lower risk of cirrhosis, which is a chronic disease of the liver that results in scarring and liver failure. Now, the metabolites that we discussed before, such as paraxanthine, also reduce collagen deposits in liver cells in rats, which have similar effects in humans. Furthermore, coffee consumption has been associated with a reduced risk of gallstones and kidney stones. Now, decaffeinated coffee also reduces the risk of kidney stones, according to the Clinical Journal of the American Society of Nephrology. Now let's discuss some neurological diseases that coffee has been shown to prevent, or caffeine has been shown to prevent, which includes Parkinson's disease. Now, Parkinson's disease is a condition that is characterized by progressive muscle rigidity, akinesia, which is the loss of ability to move your muscles voluntarily, and involuntary tremors. Now, as we can recall from before, dopamine is also released when caffeine binds to those adenosine receptors, and Parkinson's disease is characterized by low levels of dopamine. Now, dopamine and acetylcholine are released to balance motor movement. Dopamine has an inhibitory effect, and acetylcholine has an excitatory effect. In patients with Parkinson's disease, since dopamine levels are low, an excessive amount of acetylcholine will emerge, which will result in rigidity and tremors. Now, just to clarify, high or higher amounts of dopamine can prevent Parkinson's disease, and lower amounts of dopamine, which are seen in many Parkinson's patients, will also have little higher amounts of acetylcholine, which result in this progressive muscle rigidity that we discussed before. Now, since caffeine increases dopamine levels, the risk of depression and suicide also decrease. Now let's move on to a question many have, and it's how does caffeine affect pregnancy and infants? Now, a high intake of caffeine has been linked to lower birth weight and higher risk of spontaneous abortion, but the consumption of under 100 milligrams of caffeine for pregnant women, which is similar to just 1 cup of coffee a day, does not produce these significant effects. Now, for infants, circadian rhythm disruption and behavioral issues are seen for mothers who consume caffeine, but this only occurs if the mother consumes about 10 or more cups of coffee, which is about 1 gram of caffeine per day, which is a very high amount of caffeine. Now, according to the European Food Safety Authority, 200 milligrams or less of caffeine is optimal in decreasing the risk for these adverse effects. Other than that, caffeine doesn't affect or harm the infant in moderate amounts. Now let's move on to the age-old question of, does coffee stunt growth? And the short answer for that is no, but there is a twist to that. Now, there was a study done by the Multidisciplinary Digital Publishing Institute 2020 with which they found that caffeine does increase cognition and improve physical performance, but it can also disrupt normal sleep cycles and increase anxiety. Now, sleep, as I discussed before, is very important for children, and this influences their height and weight. And if children do not get enough sleep, they do not grow properly, which can limit their growth. Now, if children are to consume caffeine, they can only consume under 100 milligrams per day. So in all, high amounts of caffeine have an indirect effect on children's weight and height. So now that we've discussed caffeine, its benefits, and some mild side effects, I want to discuss how to optimize the effects of caffeine so that you could feel this wakefulness and alertness without feeling these side effects that caffeine can bring. Now to start, you want to drink less than 400 milligrams of caffeine per day, and do not drink caffeine after 2 p.m. Now, caffeine is also said to be a diuretic, so you must drink plenty of water since diuretics usually bring out water from your body. Now, to avoid this caffeine tolerance, try to have periods where you don't drink caffeinated beverages. This can also reduce severe withdrawal symptoms, so you don't feel those severe headaches and the sleepiness and drowsiness. And last tip, if you want to feel caffeine sooner and faster, you want to feel the alertness and wakefulness, you could just take a caffeine pill. And caffeine pill has been shown to result in higher caffeine absorption. It can result in a faster absorption. Alright, and unfortunately, that concludes our Effects of Caffeine podcast episode. And as always, a Pomodoro day make you a doctor someday. I'll see you next time.